On arrival to the emergency department, every patient should undergo a rapid physiological assessment using the new score or National Early Warning Score, which helps us to quickly identify patients at risk of deterioration. The assessment begins with 6 core parameters: respiratory rate, oxygen saturation, whether the patient is on supplemental oxygen, temperature, systolic blood pressure, heart rate, and level of consciousness, using AVPU or notifying any new confusion. Each parameter is assigned a score of 0 to 3 depending on how abnormal it is, and these are added to get the total new score. Now, first, look at the respiratory rate. This is one of the earliest markers of deterioration and should never be skipped. Then assess oxygen saturation and note whether the patient requires supplemental oxygen, because needing oxygen itself adds weight to the score. Next, record the temperature, then systolic blood pressure, followed by heart rate. Finally, assess consciousness. Is the patient alert, responding to voice, responding to pain, or unresponsive? And is there any new confusion? Once the total new score is calculated, use it to guide urgency. A score of 0 to 4 usually suggests low clinical risk, but the patient still requires routine monitoring and clinical judgment. A score of 5 or more indicates an increased risk of acute deterioration and should trigger urgent clinical review. A score of 7 or above indicates high risk and should prompt immediate senior assessment, urgent intervention, and consideration for ICU level care or aggressive resuscitation. Even if the total score is not very high, a single parameter scoring 3 is a red flag and deserves serious attention. In triage, the new score should not replace clinical judgment, but it strengthens it. A patient with tachypnea, hypotension, hypoxia, tachycardia, fever, or altered sensorium may be deteriorating from sepsis, shock, respiratory failure, or other clinical illness, and news helps identify this early. The purpose is simple: detect deterioration fast, escalate early, and preventable collapse can be avoided. So, the new score gives you a structured, objective, and reproducible way to analyze your patients. Want to try it smarter in under 3 minutes? Use the new score. Check the respiratory rate, oxygen saturation, oxygen requirement, temperature, systolic BP, heart rate, and consciousness. Score each from 0 to 3 and add them up and act fast. A score of 7 or above means high risk patient needing immediate escalation. Remember, even one red zone vital sign matters. News does not replace clinical judgment, it sharpens it. In the emergency, early recognition saves life. Thank you.